Hello everyone. Welcome to our Hello Health session for this month. My name is Caroline Price. I am the Administrative Officer with the Connected Care Program, and I will let our speaker introduce herself today.
Hello, my name is Deborah. I'm the Nursing Supervisor for the Family Planning Clinic, the Teen Wellness Clinic, the Pregnancy Test Care Clinic, and the Breast and Cervical Cancer Control Program Clinic.
Alrighty. So this month we're going to be talking about family planning.
Yay.
So just had a few questions that I wanted to ask you.
Okay.
So what would you say are some of the most pressing issues that our teens face today?
Wow. Well, our teens, they face a multitude of issues, specifically on clinic, just learning about their bodies, dealing with the different pressures and, society today, and then sometimes not having that family structure or that askable adult that they can talk to. And sometimes they're making some pretty big, decisions, and they need guidance. So, yes.
I'd imagine, social media and all that kind of plays a role in that. There's certain things that our youth come across that probably are stimulators for those folks to kind of think one way when it might not be necessarily the way that they should think. So I'm sure that's a big
yes,
area for sure.
Yes, and peer pressure is still a thing, and so they may say one thing when they're with their friends, and then we see them on clinic, they're like, hey, I want to ask you about this for real, is this true for real? So we know that they're seeking information and they do want correct information, but sometimes they don't always get that, especially in the midst of their peer group. So we love our teens.
So how would you say family planning plays a role in the teen health and well-being overall?
Our role really is just to be a support for them when they come in. We give them evidence-based information. We show them what's available to them. We explain our services. We ensure they understand, what they're consenting to. The great thing is, given that they're young, they don't have to do a lot of different procedures, but we want them to know exactly what they're doing, and so they can make the choice that's best for themselves. And we absolutely never want to be a barrier to parents, or anything like that. So we do encourage them to talk with their parents or an askable adult about the choices that they're making. So we're just here to support them in that health aspect of it.
So what would you say are some of the available family planning methods or services that are in Cumberland County for our teens to utilize?
Well, the wonderful thing about the Cumberland County Public Health Department is that through the different resources that we do have, we have just about every method right here within our facility through our 3,4-DB medication program, which is not ours, but it's housed here. So basically that means our team have access, or even our family planning patients have access to every method. The only one that we don't carry in the pharmacy downstairs is the patch, but every other method, as far as like your IUDs, implants, depot, and things like that, we have right on clinic. And obviously if it's like a prescription, they can get that downstairs. If they have insurance, they can go to a pharmacy. But we have all methods, and we do same day starts as well, unlike private practice in some aspects.
So do you come to find that maybe folks tend to come to our health department more often than a different resource just because of the flexibility of those services, or is that something that you have come across at all?
I would say that we do have patients, for example, with respect to Depo-Provera. They know that we do same day starts, and they know that they can get their medication right there, their method right there on the floor, as opposed to some private practice. They have to go for an appointment, order the medication, wait for it to come in, bring it back. So they like the ease of use of our clinic.
Okay. So what role would you say does sexual education play in preventing teen pregnancies or promoting health overall?
Well, we try to make sure that the patient visits, or especially with our teens, with all patients, that they are centered on the individual needs of the client. And so we really educate, kind of generically across the board, but for what they're looking for in that moment. So sexual health is so big, and sometimes their rationales for why they feel like they need birth control or don't need birth control may not be like what we may think. Okay, we're the professionals, we have one thought process, but it's the patient. So at any rate, we do explain to them, hey, you made a good choice if that's what you want to do as far as taking this birth control method, but just so you know, this doesn't prevent STIs or HIV. So we have to do that twofold method, because sometimes their mind may be only on preventing pregnancy, but we want to talk about preventing transmission of sexually transmitted diseases as well.
Okay. So I guess kind of to piggyback off that, are there certain programs or things that you all do out in the community to kind of promote that service here?
We try to promote our clinical services. It's a little difficult sometimes because, sexual health is kind of a little taboo sometimes as it pertains to teens and with parents. So the good thing is we do have parents who that agree with, what we do. And yeah. But it can be just a little challenging sometimes. But yes, we do go out in the community and we do talk to our teens and things of that nature and try to promote whatever way we can. Mm-hmm. So we can do abstinence only kind of education, or we could talk about comms. It really just depends on the location and the needs of the group.
Okay. Yeah, you kind of made a little segue into the next question. So how do parents and caregivers have those effective conversations with those teens when it comes to sexual health in general?
It's kind of, you have the side that has that conversation with the teens. You have the side that's like, not in this lifetime or ever kind of thing. So it's really kind of tricky. The good thing is that the teens do have a place to come. And I try to let the parents know, again, hey, or the guardians, look, we're giving evidence-based information. It's better than them getting it from Facebook or some social media, something that may or may not be true. And so we can talk sometimes with parents about how to have a conversation with their teens. We have tons of health ed with respect to teens and stuff like that. And so things like how can a parent, how can you start a conversation? Or as a teen, how can you start a conversation? So we kind of keep it along those lines.
So in with respect to that, how often would you say stigma plays a role in those conversations?
Stigma, it really just depends. Okay. I ain't gonna lie. It just depends. A lot of our teens are accompanied by, they don't have to be, according to the current North Carolina law as present. Some of them come with their parents or their guardians. Others don't. So yeah, we just try to get that stigma, kind of push it out some, because like, look, we know that the teen telling us they're having sex, so we want to make sure that we equip them with what they need, to make sure they have a better outcome.
Okay. And I kind of touched on this a bit earlier, but what resources are available, whether it is here at our health department or externally? What resources are available for our teens that are seeking information around the services that can help them with reproductive health?
Well, on our Cumberland County website, there's different things they can see there. There's so many websites. We kind of have that stuff listed out. We kind of give it to them. We connect them with our health ed department sometimes if they want continued conversations about sex ed. There's just as many ways and many things. I can't give you a list of all the different sites, but there's tons of legitimate information out there. Perfect.
So how does our health department specifically address mental health in teens?
Sadly, so a lot of our teens do suffer, PTSD and depression, things they're already diagnosed with. So we're not saying that they have those things. We know they have those diagnoses. And so we have some organizations that we do put them in contact with. We do try to encourage them to seek mental health services. Sometimes within our culture, i.e. Black culture, it's kind of taboo to see like a psychiatrist or a psychologist, something like that. So just having that conversation and let them know that, hey, sometimes, everybody needs help and there's no shame in it kind of thing. But there are some resources, and unfortunately, mental health isn't something that's funded greatly, and it's not just a North Carolina thing, it's just across the board. So, but there are resources for them. We do connect them with that. If we ever have a teen that comes in crises, they never go out the door without being connected with the resource. And sometimes they've had to be, transported out, but we always want to make sure we get them connected, get them what they need and set up. So we look out for that.
That's awesome. That's awesome. So I, again, kind of touched on this before, but what are some of the common misconceptions that teens have about contraception and sexual health in general? What do you guys see the most of when they come in here?
Teens are so interesting. So I will say the younger they are, so I didn't throw this out here, but in family planning, the Teen Wellness Clinic, which is in family planning, is between the ages of 12 and 19. So my younger tweenies, they're not necessarily looking for birth control or even having sex. They just want to, as they say, get thick take some Depo so they can get thick, or they just kind of don't want to have a period. So that's like their main motives for, you know, getting on birth control. Sometimes they do have misconceptions that birth control or certain types of it can, but they don't want to. Some of them don't want to gain weight. Oh, it's going to make me fat, or, you know, it means maybe I'm thinking about having sex. Well, you are. That's why you're coming to look for some. But most of the misconceptions come from things that they say their parents have told them. Things that we don't do on clinic, and it's too much for camera, but we're not checking you to see if you're still a virgin. So they come with like the old school kind of thought process like that, like, no, we're not doing that here. And we don't want them to, we also want them to know rather that they have rights as a patient. We're not doing anything to them that they don't want us to do. And for the most part, our teens don't have to take their clothes off. If they want to, they can self-swab. They feel like they have like something they need to get checked out. So it's very minimum. It's very minimum. And we don't make them take any method. We're not here to push any methods on them or say, oh, you know, it's better that you get a IUD because you're never going to remember pills. No, it's absolutely their choice as long as it's safe for them.
Yeah. Okay. Yeah. That's new to me. I did not know that they could actually self swabs. That's new to me. So, in a general scope, how can our community help to support teen health beyond a clinical setting or a setting here at the health department? What can our community members do?
All youth, but our teens need guidance. They need people who can be there for them in their life. They're not too busy. They're not burdened down in their own lives. So you can't give what you don't have kind of thing. And so most of the teens really just need somebody who's responsible just to talk to. They hold so much stuff on the inside, and then they usually, if they're acting out, and sometimes they're having sex because they're acting out, it's because they just don't have that connection with an adult, a responsible adult, you know, to speak to about things in life. So just being there and just taking the time to stop what you're doing to ask them how they're doing. And I know I myself, I'm almost 50. I come from a generation where, you know, what kind of problems do you have? You're just a kid, you know, like, what do you mean you're stressed out? You're just a kid. Like, well, these kids are stressed out. So they got a lot going on too. So let's acknowledge that sometimes kids can be stressed out. They have a lot going on. Puberty is not fun. I don't think any of us would want to redo that again. So just being that they're present in that moment with them, having conversations with them on their level. You know, and then don't get all squeamish when they open up and start telling you everything you don't want to hear. Right. You know what I'm saying? But still be there for them.
And that's a big thing too. I think we use this verbiage all the time, but meeting people where they are. That's anyone, whether that it's a teen, a tween, an adult. Right. I think, you know, you touched on that really well. Meeting people where they are is really where I think we can kind of bridge that gap the best as well. So, and again, kind of, you know, what do you say? What impact does peer pressure, like you mentioned earlier, have on choices that our teens make? Just those continued conversations about, you know, again, old school, birds of a feather flock together, show me who your friends are, tell you who you want to be kind of thing. So just reminding them life is about choices, you know, and peer pressure, especially social media is just so big with them. You know, we grew up in, I'll speak for myself, in a time where, I mean, if you call somebody and they were home, you just had to wait till later. You know, we didn't have TV. TV went off at like 10 o'clock at night. So they are constantly inundated by images and pictures and all this stuff. And I'm just like, okay, I need you to understand that stuff isn't real. Most of it's fake. What you're trying to emulate is not even a real thing. So the stress just comes from that. So sometimes, like, you might want to a little bit just push off the social media all day long, seeing something that you think that you're not, or you're striving to be something that's not even real. It's not healthy. So, like, you know, get up, go play basketball, go take a swimming class or something. Do something besides look at images of things all day. So try to steer them in that direction and get them to see there's other things to do besides social media. Perfect. Well, that's all that we had for today. Just wanted to say thank you all for joining us, Deborah and myself today. Just wanted to let you all know that you are able to watch reruns of our Hello Health sessions on YouTube, as well as Cumberland County and CCNCTV. And again, thank you all for joining us, and we'll be back next month.